Diversity, equity, and inclusion is so important to healthcare because healthcare is one of those pillars in society that affects everyone.
DEI is important for healthcare because it will literally save lives.
Diversity is very important in healthcare industry. If I am examining or checking a patient, he is from a different ethnic background. So I need to know their needs.
DEI is important because it's the right thing to do.
I think it's our mission, it's our duty, it's our promise to our community that regardless of who you are, you have a right to affordable, high quality, accessible, compassionate healthcare.
If someone is not comfortable seeking help, they're going to wait until the last possible moment. And we're going to lose beautiful people because they can't see themselves or they feel that they're not going to be treated fairly or the same. And that's such a loss.
Having worked here in various capacities and having been a patient here, really wanted to be able to be in a place where I could help their voices be heard and advocate for those who don't feel like they have a voice. I know the benefits of having people with different voices, different viewpoints, different skin colors, just different backgrounds, all working together to provide care.
When I started working in healthcare and I didn't see myself represented either in my identity or my pronouns, I really took it upon myself to be that person and shine that way so that if someone else could see it and say, that is me, you know, that looks like me, that sounds like me, I'd rather be the squeaky wheel so that other people can be more comfortable.
DEI has been very important for me. I intersect many lines of the spectrum. I'm a woman, I'm Black, I'm Latinx, I'm born in another country, I have an accent. I am familiar with the feeling of being the only person of color in a room and in a way having to advocate to the other people that maybe this point of view will not cover everyone that needs to be covered.
When I think about experiences when it comes to DE&I, and the reason why I think it's so important is because for me, it's not really just an experience that defines how I view DE&I. It's a lifetime of lived experiences, right? Where I've seen it work well, where people are included and valued for who they are. But more often than not, I see it where it's a challenge and a barrier, right? And so for me, it's so important, the experience of it, because I've lived it, I've seen it, where two people can walk in, look and sound and be different individuals, walk into the same place and have different outcomes, right? And not different outcomes in the sense of, yes, different is good for me and different is good for you, but different outcomes in the sense of mine is a lesser experience than someone else. And so that's where the fight for, we really need to change that and create equitable access comes from. And that's why I wanted to be a Chief Diversity Officer.
So we need to understand that, and we cannot learn until we have a diverse staff available, or we deal with diversity, or have people coming from various ethnic backgrounds come and work with us and teach us, and we learn these things.
You want your organization to represent your community. When you can have your workforce present as their true self and be accepted and feel comfortable, they can really engage more.
As a provider, we are an organization that is a collection of providers and caregivers. I think we recognize that we serve a population of different people from different backgrounds with different cultural norms and expectations of the healthcare system, and everyone is going to, at one point or another, need high quality, accessible healthcare that is compassionate. And it's our mission, it's the vow we take as providers, it's our job as employees to deliver that to our community. And so to me, diversity is about recognizing the many different kinds of patients and situations that we need to be sensitive to.
Diversity, equity, inclusion in healthcare is so important for people who work here and employees because it changes our lens and how we interact with people, right? So we see people in their full selves and appreciate the difference, and that's diversity. It's not saying I want you to be like me, I want you to speak like me, look like me, expect care like me. Is that I appreciate how you appreciate your own value and difference, and that's diversity. So employees, when working with patients, it's so important that we understand that, right? That diversity, equity, inclusion is We appreciate people for how they are, still give them fair and equitable access to the healthcare they need, and include them on decisions, right? No matter how they may look, sound, act, or believe, or identify.
Certainly as an employer, I've heard anecdotally on a few occasions that some members of our community feel uncomfortable applying for a job at CMC. That when they've come to the hospital, they don't see people here working who are members of their own groups and communities. And that's not something I ever experienced until I heard about it from a member of a particular group in our community, and that made me feel badly. I don't experience that, and I would commit that the leadership team here is committed to making Cayuga Medical Center an employer that every member of our community should feel comfortable coming and applying for a job and being part of the great work that we do in the forwarding of the healthcare that we provide to our community. And so, regardless of the reason, I'm not happy and committed to change it if there are people who feel, for whatever reason, that Cayuga Medical Center is not an employer that they feel comfortable approaching for a role in fulfilling our mission.
For the organization, it's not just engagement and profits, but it is the right thing to do. You want people that come to work here to feel like they belong and they are in the right place.
Whether I was back in my country of origin or I lived in Dublin, Ireland, the common theme for me is patient care. Areas you see little different than any other given area. So you need to understand their cultural background. So that is why it was very important for me to know their values, what are they expecting, and how we approach them.
We all can do the work of thinking about like, oh, how can I help this group of people feel more included? Not just because it's the right thing to do, but because we live in a community, and as much as we like to think that we're individuals, we don't live in a vacuum. And as COVID taught us, like that was a great equalizer for a period there where we're all, everything that our community does affects all of us.
This push for diversity, equity, inclusion, it has been there for decades. And us as an organization, we have to respond to our community. So we have to listen to what they are asking for. And what they are asking is, one, they want to be heard, two, they want to be seen, and they want us to reflect who the community is. So when they come to be treated, they feel respected and welcomed and included, and they can have the excellent experience that we want to provide.
The work is really, I think, accomplished when everyone buys into the idea that I own the responsibility of diversity, equity, inclusion, right? That I can create brave spaces for people, that I can speak up for and with or support people. That's how you really know the work is done. But the good thing with that is, well, the good and bad thing with that is, that type of work is never done. There's always been a historical context of trying to fight for equity and inclusion. And so that's always going to be a space to work on that, which is not a bad thing. That's really a call for all of us to say, how can we dig our heels in and find ways to create that access and equity?
To invest in change is exhausting. Being uncomfortable, sitting in the discomfort, that's what this work looks like. So I think we never are done, because as much as we learn one thing, we may discover something else that we didn't know. And then we have to think, how do we address that? How do we make this better? How do we help learn more about this group of people and help them feel respected and dignified in their interactions with our healthcare systems?
We are in such a moment of growth, especially with DE&I and the LGBTQ+ working groups. We're pushing forward to such an astounding amount of acceptance and growth and change, and I'm really excited for what that's going to look like for CMC and across Cayuga Health Systems, because I know that we're really making strides for inclusivity and just making sure that we're doing the best that we can by our patients and our community. So I'm really excited to see that grow.
Obviously, we didn't get here overnight, and so we're certainly not going to get to a place of perfection in DEI, if such a thing exists, by like next year. But hopefully, people will be able to see, and we can see within our own hospital community, as well as our healthcare provision, that we are making better strides into in welcoming and making a safer place for our LGBTQ community members and our people of color and people who are disabled and those who don't feel like they are remembered when they're here in the hospital.
And on the inclusion side, we believe that the people who comprise the healthcare system, to the last one, should be brought into the fold and be a part of shaping the healthcare system and how it operates. And so we want people to be invested in our organization. We want them to be part of transforming it. We're constantly modernizing it, but we need to have everyone's voice at the table on how to do that. And again, we want to be sensitive that if people come from different backgrounds, they're adding to the solution set. They're able to, through diversity, put more solutions on the table, different perspectives, and that is part and parcel of good problem solving, is having a diversity of options from which the best one would be chosen.